right, so that means we're going to start reducing accommodations, right? We're going to start doing less for our adult child. We're going to stop protecting them from less. We're going to stop putting so much effort into adulting for them. So what's going to happen? I think you guys all are probably sitting there being like, oh, it's not going to be pretty. This is kind of the part of my parent training where I can just see, if I could see all of your faces, I could see like the dread, the anticipatory dread, because we know when we stop accommodating, that everybody in the family system is going to start feeling so much anxiety, so much uncertainty, and even like some blaming might happen, some fights will probably happen. It's not going to be pleasant, let's be honest. However, I'm here to tell you that after that initial emotional uptick, your adult child will in fact learn that those feelings and those thoughts are safe and manageable. They're unpleasant, but they can handle it. Right? So your adult child will learn that when they stop fighting their anxiety or their avoidance and allow for the discomfort of real life, their fear will eventually begin to subside. So this, in sort of the anxiety treatment world, it's called habituation, where the more we're exposed to something unpleasant, the more we kind of get used to it, and the more our bodies and our brains are like, actually, I can handle this, right? Your adult child might start to realize that their fears are less likely to come true than they thought, and they might be more willing and more open to manage themselves those everyday levels of risk and uncertainty. All right, so there's kind of two big schools of thought around adult parenting and parenting of difficult high dependency. One is Dr. Ellie Leibovitz through SPACE, Supportive Parenting for Anxious Childhood Emotions, out of the Yale Child Study Center. And he is just now developing and publishing things for the failure to launch, the so-called failure to launch, which he's also terming highly dependent adult children for that population. There's also Professor Omar's work in nonviolent resistance. So this is for family systems change, but specifically for family systems where the adult child is very unmotivated to change, which honestly might be most of your adult children. They might want to change, but not be motivated. And those are two very different things, right? And oftentimes the parents are the ones coming to me, especially because they're the ones that are very motivated for treatment, for progress, for breaking these cycles. So the NVR approach talks a lot about minimizing the escalation of conflict. So this means holding firm and having healthy boundaries, but not giving in to sort of the drama that ensues. And there's many techniques for this. The one that I would most suggest is called gray rocking, which basically means that when your adult child is highly dysregulated, you're not getting hooked into that process. You're not arguing with the temper tantrum, so to say. You're not really engaging. You're saying, I see this is hard for you, and I'm going to go over here now. And that's a very difficult thing to do. And I'm very much simplifying it for the sake of time, but you can look up resources on gray rocking and how to implement that, how to have a conversation where you don't get pulled into a dramatic exchange. MVR also focuses on parents changing their own behavior and noticing their own emotional blockages rather than focusing on the adult child's behavior. And this is the work that I do as well. Your adult child is not at this webinar, you are. And so we are really focused on what we can change and ourselves and how we are enabling and perpetuating unhealthy behavior. We also want to rely heavily on social supports that are external to the family. a lot of parents of highly dependent adults are, facing maybe shame, maybe other kind of difficult stigma. And I am very much asking you, you probably can't see this, but there are thousands of you here right now. This is a very prevalent issue. This is not, specific to any one family. This is a generational issue. And we really do need to build on the social supports that are external to our family. We need to get into support groups. We need to talk to other family members that have launched and those that haven't, and get other people on your team so that you don't feel so isolated in this process. Your adult child might be resisting change, but you don't have to. You can really move headlong into the process of changing your own side of the equation. And also, MVR talks about maintaining focus on the parts of the family system that you can control. We can't forcibly, make somebody work, but we can control whether or not we pay for the Wi-Fi, for example. So there's very much a focus on what is really in our wheelhouse to control.